Well, welcome everyone back to the Yosan University 39 Gen podcast. I have an awesome guest with me today. Would you like to tell people who you are and a little bit about what you do?
Hello, everyone. My name is Kerri Westhauser, and I am an acupuncturist, an herbalist, and a teacher. And I live on the East Coast of the United States. My practice, I used to have a couple locations. So I had an office in Washington, D.C., and then in Virginia. Most recently, due to teaching, like just teaching more than I have in the past, I closed one. So now I'm fully concentrating in my Virginia office. And most of the classes I've taught over the years have been much more herbal focused because although I do both, acupuncturist, herbalist, my real passion is in herbal medicine, and I'm approaching my 21st year. So it's been a while.
That's awesome. Well, first of all, I want to dissect everything there, but let's talk about that. What is so special for you about herbal medicine, and why did you gravitate towards that?
It's really interesting because like my teachers and everything I'm going to say, I'm sure everyone has heard, through their teachers, right? But my teachers always talked about in our syndromes and all the patterns we talk about in Chinese medicine, that so many of the syndromes like overlap, so many syndromes evolve into each other, and like diseases evolve and transmit, right? So these diseases evolve and transmit, and they get very complicated. And as they get complicated, there's like an evolution of symptoms, et cetera, et cetera. And they all said the same thing about how you have to have keen observation, right? Mm-hmm. And because so many things change as you see this evolution and transmission. And every time they talked about it, they would say the most complex disorders require herbal medicine. And not only require herbal medicine, but they require like vigilance. Like you have to be vigilant in your observation of a patient. And as you're vigilant in this observation, your formulas have to change. They have to be like something you review constantly. And the more this was drilled into my head, the more I thought, well, gosh, I can't just learn herbs from a base level. I can't just learn, this herb is in this category, or this herb has this action. Because the way they described this to me or to our class, it just sounded like I kept hearing the words vigilance, being constantly observant, being very flexible in your formulas and able to like observe a patient and then change the formula. Because they require this, again, this word vigilance. And so I think whatever that stoked in me, it stoked in me that if I was going to do this well, I'd have to commit a different level of training than just, let's say, hey, I'm going to learn the basics of herbs and the categories. Yeah. And from that, I fell in love with it. So what started as a teacher, our teachers instilling this in me, I just loved it. I couldn't wait to learn more, get more books, dive deeper, learn where the plants grow. I mean, it just kept going and going and going. And then before I knew it, that passion was spilling over and I began teaching.
I love that.
And once you begin teaching, you really come to learn what you don't know.
Yes. Right.
Right. You come to learn what you don't know because you have to it's in your head, right? A lot of this is in your head and in your heart, and it's in there. But when you have to explain it in a way that's understandable, digestible, interesting, something that has a bit of spark to it too, to excite a student, and you have to explain it with that level, you come to see, gosh, I need to learn even more. And so this long answer is to basically say that it started with teachers and understanding what it would really take to deal with complex diseases and the vigilance it would take, the observation it would take, and then when it gets to formulas, the flexibility and the continual review of the formula you're giving to make sure it fits this constellation of signs and symptoms that are morphing. So it's a long answer to say that,
No.
As you keep going in this, and then eventually if you do get to teaching, you'll find you have to learn another way to explain this once your patients say to you, what am I taking?
Right.
Because you don't explain the same way to them as you do to a student or a colleague. And so that also requires you to learn even more, because you have to find a way to distill it so that it sounds like something a lay person could say. I think I understand what you're describing in a basic way. And so this long thing is how I kept diving deeper and deeper into the study of herbal medicine.
I love that. There was one of the things that's always fascinated me by herbs, and this is something that I remember this scene in a movie, and it might have been a Harry Potter movie or something, but they were making an herbal formula, and then suddenly this last ingredient was sprinkled on the top, and the whole formula changed colors. And why I'm bringing that up is because there is this interplay of the herbs with each other. And so you might have these 4 herbs and you add this 5th herb, and those 4 herbs function in an entirely different way when you add this 5th herb. Maybe that herb guides the whole formula up, or maybe it pulls it together. But there's such an interesting interplay of the herbs with each other. How did you learn how to really, what was it that helped you just kind of really understand these actions and interactions well?
It was another teacher. Another teacher described to, again, us, the class, that all of learning of Chinese medicine is circular. So there's everything, it's not a linear way to learn something. Like you learn it and then you just keep going in a linear fashion. With understanding circular learning, it was taught to me at some point that the highest level of herbal prescribing is temperature and flavor. And when I first had learned herbs, it was I'm learning categories. Where does this herb sit in a category? And learning formulas. But once I started to come to the realization that it was much more about flavor and much more about temperature, the next teacher said it's also about directionality. So it's not just, an herb is sweet, an herb is, warm. But you have to come to understand the direction the herb has an affinity for. Like you said, does the herb have a strongly descending action, right? And then beyond that, you start to, like you said, with the reference you learned when you saw one item being added and it completely changes it, you start to see all of the combinations, all of the herbs as they come together and how they oppose each other, how they assist each other. And again, it humbles you as you start to say, well, gosh, I'm not sure I really understand all of this. And then, of course, that drives you to study more as you say, well, I know it's in this category. I know its temperature. I know its flavor. What is its directionality? What is its affinity? What am I, again, sorry, it's always a teacher, but
No,
another teacher of mine really instilled in us the next layer of learning, which is when does this herb grow and when is it harvested? Like herbs that grow in summer, really, and others that are in winter. I never forgot it with a formula, Xiao Chai Hu Tang. Of course, I'm not going to remember. My teacher would be upset, but I think Chai Hu has either a winter affinity or Huang Qin has a summer affinity. I hope that's not wrong. But point being, that's a whole nother way to see the herb is when is it planted, when is it harvested? And we do know some formulas that have the name in it, two solstice formula, when you pick herbs at the solstice. These things are not to be forgotten. And yet, if we don't add those additional layers on, it just becomes memorization, right? We just say, oh, I've memorized that formula, quote unquote, I know what that formula does. But when you really decide to devote your career and your life to deeply understanding herbs, herbal medicine, treatment design, diagnosis, when that becomes your passion and your life's purpose, you just automatically, you hear an herb, let's say chai hu, you hear it, and you just don't think, oh, it's acrid, cool. You start to think of when it was planted, when is it
Yeah.
harvested? And when you're new to herbs, it just sounds like, oh my gosh, this is just too much. But as you add the layers in time, it becomes more like, oh my gosh, you just feel like you just can't eat it up enough as you give
Yeah.
yourself time to get there. And I think, again, that's always every student, right? We want to get it done. We want to get out of school. We can't wait to practice. That's great. That's wonderful. But those other layers take time. Sometimes people will ask people like me or others, like, how did you learn all this? Well, it took years. It took years
Yeah.
and years. And I absolutely do not know enough yet. And it doesn't
Right.
mean that it's seeking something that you can't attain, but it's just more a matter of, making sure that, just like people, if you want to get to know a person well, you can't get to know them, deeply well as quickly as possible. Their nuances often show themselves to you in situations, just like an herb's function shows itself to you in formula situations. I'll say this, one of my teachers had a great line about ginseng, renshin.
Yeah.
And he said that his teacher told him that if you try to look for it in the wild, if the plant senses that you are not worthy of it, it will hide. And, things like that, I never forget. When you hear stories like that, you'd think, wow, I have to be worthy.
Right.
I have to be worthy of this herb. And that's like a whole nother level to herbs. And again, I know I'm rambling, but it's
No.
exciting to go beyond memorization. It's exciting to go beyond, oh gosh, how am I going to remember all this? And it's exciting to think about something that through the course of your life will just become more and more interesting and will make you a better and better clinician too. It's in service to your patients to take this deep dive and to sign up with a full heart, right?
I love that. There was something that I remember again from another movie. I'm a movie person. But the two movies that popped up and they were really interesting. One was in the Korean TV show Kingdom. And like there's like all about it's circles around an herb, the whole thing, and it's in the ancient past, and it involves zombies, which makes me always have fun. I love zombie movies. But one of the things is that they're seeking out this herb, and so they're climbing the mountainsides looking for this herb. And then in another movie, I watched The Hobbit, and he gets struck by an arrow, and they're out like, we have to find this plant that grows. And what was so fascinating to me about that, and just thinking back, a couple hundred years ago, now we're so lucky to have access to all these things, and it's stocked and it's like regular. But like when you were talking about the season the plant grows, I think about that sometimes. I love avocados and I also love artichokes, but there are parts of the year where I can't get either because it is this seasonality to these foods. And there is this added dimension of that. And so when you were talking about that, I just thought about, it's so interesting to see that the medicine that we use is a living medicine. These plants grew, and were someone farmed them and harvested them. But you think back to the time where they were foraged, and people would climb the mountains looking for the best ginseng, and it's just fascinating in that way.
Yeah. And can you imagine now we're growing and, we're cultivating things, cultivating herbs. And, many times the herbs we can get our hands on aren't being grown, harvested, planted on the side of this particular mountain.
Right.
and harvest it at this particular time. There are definitely farmers trying to do this, yes, but it's so difficult with the amount of demand
Yeah.
that is, being asked. That is a huge issue. How much demand there is for herbs. There is a definite push for more domestic production of herbs. In the United States,
Mm-hmm.
right now, I work with as much as I can with farms up in New York
Yeah.
and also California, Oregon, because it's that idea of the more we can buy here, it's kind of like a threefold. It helps the farmers here in the United
Mm-hmm.
States, helps with jobs. It also reduces cost. Sometimes the
Yeah.
herbs can be a little more costly in domestic production because it's small amounts they're producing. But again, there's a huge push for at least getting that movement going, which it's already been going. Then with the hopes of maybe then we could plant the plants according to when they should be and harvest the plants according to when we should be, because we'll have better relationships, very specific ones with farmers. Like I actually now can say, I don't know them like best friends, but I have some acquaintance relationships with some domestic farmers now. And that's huge because you can, I don't know if the term is pre-order or pre-buy a lot, which helps the farmer and helps you knowing what you might be able to get. If you just, pick an herb cushion and you say, we think the harvest for 2025, is going to produce, I don't know, I'm making this all up, 20 pounds. Do you want to buy this before it's even grown? You can have those kinds of relationships with domestic producers.
I love that.
Yeah.
It's interesting too that there is this push, because it's like there, people who have this relationship with the plants, people who have this understanding. Some of the farmers I met were just, it was awesome to watch them really understand the growth and the life cycle of these things that they were cultivating. It's always fascinating. Plant people are fascinating to me. I am sadly not one.
Well, no, and again, I wish I had the time, because remember back
Right.
in the ancient times, we practitioners, we would be growing these things. We would know about,
Yeah.
like, I think a lot of times the farmers, especially those who grow exclusively Chinese herbs, know way more about the plant than we do as practitioners.
Yeah.
And I think needs to change, that we need to know as much, or if not as much as we can, about the growth process and all of this, because it, again, changes what you do as a practitioner from straight up memorization. Like when you really know something well, you don't have to memorize anymore. I always tell students when I teach the herb dangui, I say, once I saw it in its just growing, right? There were aspects about that herb that I came to understand by just seeing it where it should be before it was dried and chopped up and whatever, sliced up. And that makes a huge difference in learning, also in diagnosis, also in how you see what an herb does. Again, I always feel like I could talk forever about all of this, because that's an aspect that all of us, practitioner-wise, we are lacking in. We are lacking in that knowledge, myself included. I spend more time with the dried plants, the plants that I buy that are already cleaned and sliced and, come to me. And we would really have leaps in understanding if we had an ability somehow to have either. And there are plenty of videos, I should say. There are plenty of videos on YouTube with different people who know the medicines well, in, showing you the plant and discussing it with you. But obviously, there's no replacing that for being live in person in the fields. Yeah.
Right. There was the other day, my wife brought home a food, and she was just so enjoying these little fruits, and I was like, what is that? You seem to be really enjoying it. Oh, we eat this for getting a little bit extra energy. It makes you feel good. And then she kept saying, and the Vietnamese word was "da tao, da tao, da tao, da tao." And then I was like, "Da tao."
That,
Oh,
was it Datsa?
yeah, yeah. it was nuts out, but it was the fresh little fruit, and they were just everyone was eating them, and I was like, I've never seen that like fresh. I've never seen it when it's not, processed, and it
Yeah.
was like it gave me a little bit of a better understanding of what that plant looked like, and smelled like, and felt like, and then it was fascinating like that. So I love what you're saying. Um, One of the things that I wanted to come back to from earlier in the conversation was the concept of being vigilant and the idea of a patient evolving and changing. It's interesting because in medicine, I'm not just saying in Western medicine, but I think a lot in Western medicine, um, there's this idea of like, here's your medicine. This is the medicine for your condition. Take
Right.
it. And I actually got to speak with Mazen Al-Kafaji, and it was interesting because he's such a nice guy,
Yeah.
and
He's one of my mentors. Yeah.
he's so awesome, and he was talking about how when he started out, the was training at or was working with the British Health, this one hospital, and they were running tests on this one herb, or one formula that was working really well for skin conditions. And they said, but it doesn't work for this. And he came and he's like, that's because the formula needs to be modified. You
Yes.
have to change it.
Yes.
And then they said, okay, well, let's see what that looks like. And he started working with them. And then when they changed the formula, people started getting better results. And they're like, wow, this is amazing. And they're like, what's the blanket, variation that we can do? Well, no, it's different for each person.
Yeah.
And it's interesting because one of the things that I feel like Chinese medicine is very good at is working with change. But
Correct.
we have to, as you say, be vigilant to monitor the change, to see where the change is going, and to really not miss something. And this is one of the things, like, though we're not going and tasting our patients anymore, traditional diagnosis was like all of these different things that was there. And so I would love to hear you talk a little bit more about the vigilance that we need, or just all of that.
Yeah. I would say, first off, I'm absolutely in the camp of moving away from integration, meaning like there has obviously been a strong push toward integrating Chinese medicine and Western medicine. That's definitely, you know what I mean? That's definitely been a current that is going. And I am not a fan of the current. Now, I'm not saying absolutely zero, but I would just say I'm just not a fan of I'll just tell you why I'm not, and we can discuss it. I would like us as a profession to move, instead of toward integration, I'd like us to move more to the root of our medicine. Like,
I love that.
So it doesn't mean we would exclude any, Western medicine, but I wish we would move toward the root, because as at least what I've seen in my short time, it seems like as we move toward integration, we just dilute our medicine. Like we dilute our core principles. It's almost like Chinese medicine is getting devalued in the process.
Yeah.
And evidence-based medicine, which is the big thing, right? Evidence-based medicine does not and will not and will never be able to capture the complexities of Chinese medicine. So it will never be able to fully capture our complexities. So what I don't like seeing is that devaluing, the dilution of the medicine, like you said, when you described, here's a medicine that the doctors gave and it worked for some and not for others. Well, obviously in our medicine, that makes perfect sense because of how I started our podcast, which is we have to have vigilant observation of the complexities of the changing signs and symptoms of a patient. And we have to have that keen observation to understand how things change and transmit, how diseases change and transmit, which they do. Yeah. And this is why, again, I'm not a fan of follow-up Zoom visits for
Mm.
patients because it takes away that vigilance that we need. It takes away. Uh, it's like removing. So, like, I can't smell a patient. I can't get a sense of a patient. I can obviously listen to them, and I'm sure they could take a picture of their tongue and send it to me, but I can't feel their pulse. I can't get a vibe of how their limbs are feel. I can't palpate, right?
Yeah.
And as things transmit and change, which they do, it just removes all of our power to help them. So I always say I wish we would keep moving toward the root and away from integration, because again, the dilution of our medicine is weakening us. It's weakening how we can be in service to our patients as well. If a
Yeah.
patient walks in the door and they say, I have low vitamin D and they get labs, or it doesn't mean we shouldn't pay attention to labs. It doesn't mean we shouldn't pay attention to MRIs or whatever they bring us, right? Scans and blood work information. But as far as what we do with that information is another story, right? Does that
Right.
information in any way, improve your formula or help you tweak that formula? Or maybe it's an acupuncture treatment. Does it help you choose a different point prescription? Does it? And the vigilance I'm describing, I want to be careful. I'm not saying it's absent in Western medicine, but the Western physician has to see 30, 40, 50 people a day
Yeah.
in 5 to 15-minute increments, because I have colleagues who are telling me they have 10 minutes per patient. These are our Western colleagues.
Yeah.
I don't know how vigilant and keenly observant, and I mean, God, I couldn't do that. I couldn't raise my game to the highest level of herbal prescribing if I had 10 to 15 minutes and I had to see 40 to 50 patients a day. I definitely could not do that. And I'm not saying someone out there couldn't. Someone could, I'm sure. But to be that mentally flexible and vigilant is as our word, and be able to be so not only keenly aware of what to do, but understanding like, oh, that patient's symptoms have transmitted. Oh, these 3 signs and symptoms have vented or cleared, or, you know what I'm saying? It requires a tremendous amount of insight. So for me, it's like a 2-part. One is I would like us to move more toward the root and away from diluting our medicine and devaluing our medicine, and just coming to the conclusion that evidence-based medicine doesn't fit or should I say, doesn't capture fully Chinese medicine's complexities. And then that we really need to be taking to heart the pillars of Chinese medicine, right? The pillars, the
Yeah.
inspection, all the things you learn in day 1 of Chinese medicine, the
Right.
inspection and the palpation and the inquiry and the smell and those things, the value on touch and palpation. It's hard to quantify that. And so that's, again, the more we bring that back and move toward the root, all of the information is there for us. Our amazing, the shoulders we stand on, all of our amazing colleagues who have come before us, the scholar physicians, they were so in tune to the natural order, right? They were so in
Yeah.
tune to the seasons and the constellations and agricultural shifts and changes, and that they understood how that affected the human form. And that, again, is something that is missing from our medicine too, because we have air conditioning and we have heat being pumped into our homes, and we have, most of us, right? Most of us who have these things, but it changes the way we relate with nature if we can always change nature, right? Like back to what you
Mhm.
said, if you wanted an avocado, sometimes it's not in season. In Washington, D.C., I can go to any grocery store 12 months of the year, right, and get an avocado.
Yeah.
And that doesn't help me relate to the natural changes that are occurring and the seasonal changes and how they might affect me. But it calls us as practitioners to be reminded of we need to pay attention to the seasonal changes for our patient. We need to pay attention to when the winter is too warmer than it should be for our patients and how that will affect their asthma, let's say. These are the keen awarenesses that we as practitioners need to pay attention to. What is the humidity? What is the weather? It's like we have a whole nother layer of things we need to pay attention to for the patient, right? And that is the vigilance. That is the vigilance.
Well, I love that. And I love that this idea that, there is no one size fits all for everyone. It's so unique. And I saw that with what you described. I have practitioners that I know that really they started selling like formulas, and it was similar to what people do with patents, but they were coming up with all of these different things. Like, this is GIEs, and this is my GI formula, whatever GI issues you have, just take this. And it's just like, well, that's not how things are practiced. That's not how it's done, because, with being vigilant, you are paying attention to, well, this week your patient comes in and they suddenly have been, dealing with some heat, and you've been seeing those heat symptoms, but today they suddenly describe a feeling of heaviness in their head, as if they felt like a wet blanket was wrapped around it. And I was like, "Ooh, I know that. I know where that comes from."
Right. And that's real life. That your patient, I have a patient right now who has long COVID, and within 5 days, I've heard 5 different things that weren't from the original intake. That, again, when I inquire and say, "Tell me more," they'll say, "Well, this isn't typical." Okay. And then the next day I talk to them, "Oh, I now have this, but this isn't typical." And so this brings it to what you're saying. If you have a formula that you create or buy or shelve or just, give to patients, it's like you're trying to fit that patient into that formula, which is completely devaluing our medicine. It's westernizing our medicine, right? Yeah.
I've got a great analogy. I love living. One thing that I love living about, rewind in that sentence. One thing I love about living in Southeast Asia is the custom clothes. I remember growing up, I am not built like most people. I am tall and lean. And when I try to buy a suit that is the correct length, it is always quite wide, the correct width, and it was always too short for me. And I was never able to wear suits growing up. I remember having these pictures, and I have these really wide shoulders popping out because it was the correct height. But now when I go to the tailor and I have a perfectly fitting suit, and it is just, I can move in it, I can flow in it, I can feel confident in it because it was made for me. It was completely made for me. And the same thing is true when you have a custom formula. You're really looking at what it is that this person is dealing with and customizing for that. And it's not like you might not get results over here, but it's not going to work completely correctly. But this will work right. But again, you have to be vigilant. You have to observe and really observe well.
Yes. And that's part of that knowing a patient.
Yeah.
In knowing someone, you really come to understand, like you said, not just their height, or like you said, you're a tall, lean person. That's your physical attributes, right?
Yeah.
Then, because we also treat spirit first, right? Which is not a Western medicine concept. In treating spirit first, which is what our classical texts instruct us to do, that's a whole nother aspect about observation, to be able to understand someone's spirit, right?
Yeah.
And then, again, my teachers would tell me, the way you would dose or prescribe a spirit-based formula is entirely different than the way you would dose and prescribe, let's say, a physical ailment, right?
Yeah.
And they would always say, since Shen is a highly, highly refined substance, you don't need full dose. You need like a third of the dosing or lighter. Anyway, just so these are, again, nuances about treating spirit and being keenly observant of a patient who comes in to your office and they're anxious that day, but they also still
Mm-hmm.
have that migraine. That's why they came to see you. Well, they came to see you for migraines, but they also came in that particular day, and now let's say they have anxiousness that they don't typically have. And we have to be flexible, and there's some sort of evolution or overlap there, right? And you have to determine that. Is it just an overlap? Is it an evolution of what's going on? And as we look at these concepts of evolution and overlap and transmission, that's where Chinese medicine shines. That's where we
Yeah.
shine, right? That's like it's been this way since the beginning.
Yeah.
It's been this way since the beginning, and we can't afford to dilute it. It just makes no sense to me as a practitioner. I understand all things evolve. That's normal. But I feel like an evolution to the root just makes everything we do more, again, in service to the patient. Like
Yeah.
that's what this whole thing is about, right? So not only that customization like a suit, like you described, but also treating the spirit first within whatever physical, like we said, let's say someone comes in for migraines, right? We're not going to talk about your anxiety, because that's not what you came here for, right? And that will change and evolve constantly, because life has constant ups and downs. And as those of you, all of us know who've had any type of pain in their life, your spirit entirely shifts if you're in pain.
Yeah.
And so the customization is key. It's really key.
100%. Well, I love this circling back to the medicine, because it is its own thing, and it has 2,000 plus, more than that,
More than
thousands of years, more than that,
yeah,
3,000 plus years
yeah.
of tradition, of transmission, of doctors refining formulas, and a historical, a history of text spanning that time frame. And it's amazing that it's there. And then humans in the last 150 years took it and said, well, let's do this with it. And I understand the necessity of why things were standardized, but yet at the same time, there is this wealth of multiple traditions in this medicine, different schools, different
Yep.
systems.
Mm-hmm.
And when you try to then mix it in with Western, certainly I also understand the power of looking at all the tools you have. But I always asked that myself, like, does this help me become better? I had one professor who would always be drilling us on, certainly knowing your Western stuff is important, knowing your labs
Yep.
is important, so
Yep.
you can see and be more informed and speak a language that people can understand. But he's like, at the end of the day, to have a really good formula, a really good outcome, how's your diagnosis? And how are you doing? And are you asking the right questions? Are you going in and really digging? And how is your sleep? How is your affect? How do you feel every day? And then asking these diagnostic questions, that when someone says something, being ready to catch it. As an interviewer, I have to think ahead of where I want to go, but also at the same time, I have to listen. I have to be willing to really be in the moment and sit there and say, can I, as a host, ask the right questions so that I'm able to pull from that person the knowledge that they have? Because if I'm not asking the right questions, then if I suddenly said, hi, it's so great to speak with you today, you're an herbal expert, What's your favorite car? Are you a Toyota person or a Honda person? Well,
Think,
those are questions, and they're
yeah,
an interesting question, but they're not the right questions.
yeah. I find over all these years, I guess two things. One, um, I used to ask a lot more questions, in your initial intake or whatever. I used to ask a lot more questions. And I have found um, two things. One, I have to be mindful of a patient's narrative,
I
meaning
love that.
them telling me what they either think or like sometimes their narrative is trying to tell me or a practitioner what they think they have, or sometimes their narrative is often, you know can confuse a practitioner sometimes because they're telling you like, well, I think I have blank,
Yeah.
and I researched and this is, or they'll describe a lot of symptoms, uh, and sometimes, as you all know, the more symptoms, it can just get totally confusing. So part of it is navigating their narrative. That's one
Oh,
part I've learned over the years is how do you navigate what they tell you. That's one, and then two, I have over the years, I've decided to do tongue and pulse first,
mm,
and go from there. Um, and the value of tongue and pulse multiple times. Sometimes I'll take it when they first come in the middle of the interview, toward the end. Obviously, asking, have you eaten? Have you not eaten? What kind of medicines do you take, etc. But sometimes tongue and pulse first leads you to a whole different set of questions than
yeah,
I'm just gonna. Why are you here? What is your chief complaint? And then start running history and all that stuff like that. Sometimes that leads you to more informed Chinese medical questions than,
mm,
how is your sleep? How is your digestion? Do you have any pain? Tell me about any respiratory, any digest. It's like almost like it's like a formula. And sometimes, just like you said about knowing what questions to ask, sometimes the tongue pulse, you can just actually dive right in and say, oh, tell me about your sleep, and meaning, let's say you assess something on the tongue and the pulse.
mm-hmm.
Oh, my sleep isn't good. I have a hard time falling asleep. So sometimes what you perceive, from those things you analyze really brings you to more specific, narrowed down, instead of running the whole list of all the possible questions you can ask.
I love that. Well, let me circle in a slightly different direction as
Yeah.
we start getting to the end here. What's your favorite herb or favorite formula?
Ah, my favorite herb is unprepared Romania, shengdiwang.
Mm,
And it's probably because I am a student of and a graduate of Mazen Al-Kafaji. You mentioned him. I've
mm-hmm,
taken his course and graduated from his course. And I do a lot of dermatology. And
mm,
over the course of using herbs for a long time, and then of course I have my top 10 favorites, right? I just love the herb. I can talk about like Shengdiwang is like a very reliable friend.
mm.
It it never fails me. It always does what you all would know, cools the blood and, all the stuff you learn in herb school. But it's reliably, like it's just functionality is very reliable. In addition, I love how it smells. I love how it
It
tastes.
smells so
Every time I open the jar, I have a raw herb pharmacy. Every time I open the jar, I could just stick my, oh, what a great smell. It's like one of my favorite smells too.
good. Mm-hmm.
Um, yeah, I call it my reliable friend.
I love that. And how about this? If you were to go back in time and tell a younger version of yourself some advice about this medicine in your studies or your path, what would you tell yourself?
I would have told myself to uh, go immediately to Shanghai and stay there a
Mm,
year and learn to read, speak, and write. That's what I would have told my younger self. Because as an older person now, trying to go backwards And, when your life is busy and you have, your clinic and you teach, I can only, everything I know is piecemeal. Like I know many characters. I can kind of finagle my way through some things, but it is not in my mind and in my heart like herbs are. Like I know herbs very well, right? Like they're just a part of me. And I would have told my younger self, immerse yourself now in the language so that by the time you add on years and years and years of study, that piece will merge with the other. Because a great deal is lost in translation.
Yes, it is.
I read books all the time. I read as much as I can in English. But if I have a different version of a book, like let's say 2 books or 3 books, and I have different versions, it's unbelievable the difference, right? That things get lost in translation. And at this point in my life, I can only add on to the little I know all the time, right? I just add on a little more character to phrases. But it's a huge problem, the translation issues, right? And how much is lost because so many things just cannot be translated into English, which is why often you'll see qi not translated or spirit, shen not translated, right? Like, because there's just, how can you really define some of these words or Ming or, right? So my younger self, I would have said, go immerse yourself before you have responsibilities and job and you got to pay bills. Immerse yourself deeply into the language and the culture. And then someday when you add on all of the herbal knowledge, it'll just go like this. That's what I would have told myself. Yeah.
Right. The language side, I'm not fluent, but I'm pretty close in
Good
Vietnamese.
For you. Good for you.
And not Chinese, but in Vietnamese. And one of the things that's interesting for me is that when I go to translate things, or when I see people translating things, I'm like, that's not what he said.
Right.
That's not it. That's not it.
See,
I watch a movie and like, you take something like, and there are some things you cannot translate, raining cats and dogs, in English. You can't, when I try to translate that into Vietnamese and I'm like, mo cha meo, and they're like, dog, cats falling with rain. What is that? And then, and there's certain things that are concepts that are not able to be translated with health, and an understanding of of the wellness. And I mean, in simple concepts of visiting and living in Asia, and you see an awareness of certain health concepts that we come in as Westerners and learn about, and they're very foreign for us. The idea of wind, like, well, what is wind? Why would you? And and you see it in Asia, like, well, you gotta be careful with this or that, or it's nighttime. Don't shower. You don't shower after a certain time of night. If you do, you dry your hair. You make sure that you are, and it's like, it's one of the things too, that there is so much that is lost.
Yes.
In not to be a pun, but lost in translation. There is so much that is lost in translation. Where do you see yourself going next?
Interesting question. Right now, I would have to say I'm staying the course for now, meaning continuing to practice Chinese medicine, continuing to teach Chinese medicine, and continuing to study Chinese medicine as much as humanly possible. So right now, it's just, I've been in a stay the course because I just feel like that combination currently is working well, meaning studying helps my practice and my teaching. Teaching helps my studying and my practice. Like, it's like a nice, the three together really ping pong each other in a good way to push me. Like, a patient comes in, they're unbelievably complex. And the more that I study and train, obviously that helps me with them. And the more that I have to teach, you follow me. It's like a hand in hand. So for now, I'm going to stay the course. But if we go further, if you say, like some people say, where do you see yourself in 5 years? unknown, meaning like, because I still feel like I need to stay the course. And that's a rare one for me. Typically, I've always had like goals, like 5-year goals, 10-year goals. And now that it's been almost 21 years of practice, I guess I'm beginning to look at my age a little differently than I did when I was in my 30s, right? So
Yeah.
I guess the only thing that's coming up for me is just, where will this go? And
Yeah.
I'm open, but right now the plan is just stay the course.